So doctor, one of the more common things that I see at Swanson Hyperbarics, especially lately and during the school year, is concussions and maybe some other TBIs. Why is hyperbaric oxygen treatment such a good alternative for issues like that?
So when you talk about concussions, which is a mild traumatic brain injury, you have the injury to the brain, which can cause, on a much smaller scale, microcellular changes. Cells and tissues start to swell. That swelling causes decreased blood flow to parts of the brain that were injured. Those parts of the brain don't work like it normally should. And that's where patients are going to develop their concussion symptoms. Things from headache, dizziness, nausea, vomiting, sensitive to bright lights or loud sounds. Their cognitive abilities, their ability to think, focus, concentrate, pay attention, memory, recall can be affected. They can be fatigued and tired because it can affect their sleep patterns. They can have vision changes, imbalance issues, and it can also affect moods. Patients can become irritable, angry, sad, emotional, anxious, depressed. So patients that have concussions, traumatic brain injuries, if we can minimize those effects by treating them on an early basis with hyperbarics, we can hopefully help alleviate those symptoms, improve those symptoms, get them back to their functioning state.
And it seems like from the patients that I've talked to, you can recover a little bit faster than the normal just sit and wait it out kind of option.
So current medical management, if patients go in to see their doctor or the emergency room, they're going to tell them, we want you to rest, relax, limit activities, sit in a dark room, stay off your screens, which is the current medical management for concussions. With hyperbarics, if we can treat them early, ideally within that first 48 hours of injury, we can hopefully mitigate those symptoms, improve them, get them back to functioning, their sports, their school, activity, work, as quickly as possible.
Why is earlier better to start treating that and then kind of go into how, on the other end of the scale, veterans that have TBI that have maybe suffered for years can still also be helped with this? So, what's the difference there?
So the earlier the better from the functionality standpoint, alleviating those symptoms as quickly as possible. Studies have shown the earlier you can do that, you can hopefully prevent post-concussion syndrome from occurring. So patients such as veterans that have had traumatic brain injuries, post-concussion syndrome, they tend to have the ongoing cognitive deficits, headaches, mood disorders that have been going on sometimes for years to decades afterwards. But hyperbarics may still have the benefits as improving those functions, getting them back to much more of a regular life that they were accustomed to previous.